and how we think they will impact our nursing practice in the future. Two trends that I'd like to discuss are the demand of baccalaureate degree nurses versus associate degree nurses and the benefit of nurse residency programs for new graduate nurses. I chose these two topics because it's something that will definitely have a direct impact on all of our nursing careers moving forward after graduation. We have obviously chosen to go the route of obtaining baccalaureate degrees in nursing, but the new concern is the emphasis on the importance of nurse residency programs. So to start, in 2010, the Institute of Medicine released its report, The Future of Nursing, which called for nurses to achieve higher levels of education and suggest that they be educated in new ways that prepare them to meet the needs of the populations they'll be caring for. The report also emphasized on the number of baccalaureate prepared nurses to increase in the workforce to about 80% by 2020. The Iowa mentioned in their 2010 report how the healthcare system has shifted noticeably in the 21st century, with the American population being predominantly older, as well as more diverse than it used to be, including cultural and socioeconomic factors. Some of these factors have contributed to the shift in the nation's healthcare needs. While the majority of healthcare today is focused on chronic conditions, during the 20th century, healthcare system was used to treat more acute illnesses and injuries. So with that information being said, it only makes sense that education of nurses would advance with the changes in healthcare. There are, in fact, distinct differences in the two degrees. Baccalaureate nursing programs include all of the coursework taught in associate degree programs, in addition to more in-depth physical and social sciences, nursing research and theory, and public and community health. This additional coursework enhances nurses in their professional development and prepares them for a broader scope of practice and better understanding of cultural, political, economic, and social issues that affect their patients and influence healthcare delivery. Throughout the last decade, policymakers have recognized that education makes a difference, which leads me into my next trend of nurse residency programs. Nurse residency programs are typically a minimum of 6 months to a year of additional education that you have to apply to and be accepted into. The continued education helps new grads feel more prepared with extra clinical hours to provide more time with patients before being put out on their own. It helps prevent the feeling of being scared and reduces new grads' turnover while gaining confidence in leadership skills. I read an article titled Residency for Transition into Practice by Dr. Colleen Good, who was a nurse and professor here at the University of Colorado and was a co-leader in the development of the post-baccalaureate degree nurse residency programs at the University of Colorado Hospital. What I found interesting about Dr. Good's research with the nurse residency programs was that it supports all the main points as to why they're important. New grads are more likely to quit their first job and have lower job satisfaction ratings because of their stress. Dr. Good and her colleagues found during their research from 2002 to 2012, the nurses in the nurse residency programs have an increase in confidence and competence, as well as their ability to organize and prioritize work and communicate and provide leadership increased significantly over their course program. The retention rates increased over the 10-year study period from 88% to 94%. These nurse residency programs are helping nurses be more prepared for their independent practice. So to summarize these trends and their impact on my nursing career, I agree with the intentions of increasing the amount of BSN nurses to stay up with the demands in healthcare, and I fit that nursing demographic with the degree path that I chose. I personally believe that a nurse residency program would be very beneficial for my nursing career and allow me the extra time and training needed to be competent in my nursing practice with the extra clinical hours that I may not get throughout the program because of the limited time we have. I feel it will be helpful for me in developing my appropriate skills and knowledge needed as a new nurse.